My name is Mark Sandilands. I've lived in Lethbridge for almost 41 years. I'm a retired professor at the university. And I've done many other things in this city over the past 41 years. Particularly, I'm sorry there's no microphone. I'll raise my voice as much as I can. How's that?
You've got to stand right over there, right in front of everybody. And shout.
We're thrilled that there are so many people who are interested in healthcare. We tried to book the larger theater, but it was already spoken for. Things have come together in Lethbridge, particularly in the past 2 weeks, to raise a number of issues and raise the issue of healthcare in the minds of the city's citizens of Lethbridge. The purpose of our gathering here tonight is to bring together people who have concerns about healthcare in Lethbridge, in Alberta, and in Canada, perhaps North America. We want to share ideas and present some ideas for improvement, to increase public knowledge of how healthcare is offered in this country and in this province, and to perhaps get some good ideas for improving it. At the end of the meeting, we hope to have an action plan in which we can present ideas to the people of Alberta and bring some change, or perhaps prevent some change from happening, if you know what I mean. The history of this particular sequence of events goes back to March of this year, when we learned in a casual conversation that the gynecological cytology laboratory at the Lethbridge Regional, or the Chinook Hospital, was perhaps going to be closed. When we got the details from the government website about this, and some information from the Health Sciences Association of Alberta, we mounted a protesting information demonstration in front of the hospital. As a matter of fact, we had 4 demonstrations in front of the hospital, and 3 in front of the hospital, and 1 in front of the Lethbridge Senior Centers when the MLAs were meeting with seniors there. We had petitions, many hundreds of names from both Lethbridge and Red Deer, which was similarly affected. We had petitions presented in the legislature by Bridget Pasteur and Rachel Notley from the Liberals and NDP, respectively. Recently, Bev Mundell-Atherstone and I and Ray Bainborough spoke at Lethbridge City Council and got their unanimous support for communicating with the government to keep the gynecological cytology laboratory in Lethbridge. Today, in these actions, we've been supported by not only members of the NDP, but members of the Friends of Medicare, the Women's Space, and the YWCA. Today, we hear, or last weekend, we heard about a hiring freeze for nurses in the province.
Not just nurses, it's all healthcare professionals.
All healthcare professionals. And today, you might have heard on the CTV News that there's a possibility they won't be able to hire people for the cancer treatment center that is due to open sometime a little bit less than a year from now because of this hiring freeze. They have to start hiring people so they can test the equipment that is going to be coming in. Brian Mason asked to come to Lethbridge for a town hall meeting. Perhaps Brian Mason can see into the future because all of these things have come together at this particular time. So at the head table we have Brian Mason, the leader of the Alberta New Democratic Party. We have Diane Pointer, who is the former president of the Friends of Medicare of Lethbridge. She's also a retired registered nurse. We have Michelle Day, who's manager of the Porcupine Hills Lodge in Claresholm. Michelle also works some of the time at Extended Care in Lethbridge and knows that situation. And lastly, we have Dr. Bev Mundell-Atherstone, who is a registered psychologist and active with the NDP in Lethbridge. So the format for the gathering tonight will be approximately 5-word statement by each of the members of the head table. I said approximately. 5 minutes. That's better, I guess. Okay. And then we will have an opportunity for members of the audience to make their statements. I see Virgil Granfield, who wrote a very moving letter to the Lethbridge Herald. Virgil's in the back of the room, and he'll make his way to the front to make a statement. Perhaps you can work through the offices, Virgil. We hope to, Bev will take notes, and I apologize again for, we hope to have a microphone. They said there'd be a microphone, but unfortunately not. In any case, Bev will be taking notes, and we'll do a roundup of the events of the evening and perhaps notes on our action plan. We are videotaping this with a digital videotape, and we will mount that on our website, lethbridgenDP.ca. Just simply Lethbridge NDP, no spaces, no periods or anything, .ca. And there will be links to that when we get it established, so you can watch the proceedings. Okay, so let's begin with Diane Pointer.